we know that we cannot continue to fund a robust response to this disease without adequate resources, particularly for our partners in state and local government who bear much of the burden of fighting Zika. Last Friday in Atlanta, at the headquarters of the Centers for Disease Control, there was a summit that was convened with administration officials and the top state and local health officials from across the country to discuss what our response to this should be. Again, this is a pretty unique scenario. We have an opportunity to get out ahead of this disease. I don't think we're going to, the sense is not that we can prevent it entirely, but we can begin to take steps right now before the disease is widespread in the United States that can prevent it from having the worst possible impact on our public health. And because of Congress's refusal to act, our ability to take those steps is quite limited right now. So limited, in fact, that we are now actually having to take money away from the Ebola fight to try to at least begin some of those activities to prepare for the onset of the mosquito season and the potential spread of the Zika virus. But those resources are insufficient. We need a lot more resources to make sure we're doing everything we possibly can to protect pregnant women in the United States of America. That shouldn't be a controversial notion. In fact, it's a common sense one. And it's going to seem pretty common sense if and when we reach this scenario where there is genuine public panic about the spread of this disease.